Hello, folks. For those who suffer frequent headaches, there are those of them who believe that if they modify their diet or the kind of things they eat, that can improve their headaches. There are those who, meticulously search for items that they eat that could, you know, provoke or trigger, I think that's the right word, that can trigger their headaches. Some people talk about chocolate, some people talk about gluten containing diet, some people talk about soy, different things. And there are people who take their time and invest a lot into researching the relationship between what they consume and their frequency of headaches. Those who get into these things are people who get quite a lot of headaches. So is this the right approach to migraine? For those of you who've watched some of my videos in the past, you'll understand who migraine is. But the bottom line is people who have migraine tend to get a lot of headaches. So, but for those who get a lot of these forms of headaches, who suffer frequent headaches, very many headaches in a month, many people go into things of this nature. Is that a right way to approach headaches? Does diet really matter? This is what I'll be discussing in today's video. But before I go into that, I'd like to welcome you to the channel once again. This is Brain Gist. It's a channel I developed for, public engagement and education and enlightenment on, everything that has to do with neurology, the brain, the nerves, the muscles. So I welcome you to the channel. So please don't forget to subscribe, like, share, and then leave your comments behind. Now let's go into today's content, and that is, it has to do with the relationship between your diet and migraine. Now we want to first establish whether there is a relationship between, migraine frequency, that's the right term, and diet. I will not shy away from, that fact that there could be some relationship, because there are people that when they eat certain things or certain substances, they know that they're likely going to suffer headaches in the following minutes or hours. Some talk about chocolate, and in fact, not just chocolate, any type of chocolate. Some, even distinguish between white and dark chocolate. That if they take, for some people it's dark chocolate that can provoke the headaches. For some people it's white chocolate. And so some people even avoid chocolate altogether or take it very rarely just because of their headaches. So some people, it's different other substances they try to avoid. So I do agree that yes, indeed, what we consume can indeed potentially, cause us to develop headaches for those who are headache prone. And that's what we're talking about today. So yes, it is. There's also the other theory that it is not the consumption of these items that necessarily leads to headaches or provocation of headaches or triggering of headaches, whichever term you favor, but that it's actually a prodromal behavior. That is to say that in the hours to few days preceding a headache attack, there are changes in the brain which lead to people craving some of these substances, and that when they eventually consume these things, the headache now happen later, but that the headache was destined to happen anyways, whether or not they ate these things. So that eating these things was actually part of a craving behavior that is associated with brain changes that happen just before a headache. And that's the concept of prodrome, headache prodrome. That is one theory, okay? Now, but today, there definitely is some link between what you consume and, headaches. There are people that when they consume certain things that are used in the preparation of certain types of meat, like some nitrate containing substances that can trigger headaches, that we know for sure. And for those who talk about chocolate, some people can actually defend that, and if they consume some of the things. Now, what brought about this discussion today was because I actually saw a patient just yesterday, I think, in the clinic, and this patient actually came for help after they had tried everything they could. They had gone into diet, they listed a lot of things, items that they had stopped eating. Let me see if I can pull up. Oh, okay, yeah, the phone is here. Some of the items that they had consciously removed from their diet, and yet things improved initially before things go worse again. I think I'll try to pull up what I wrote down for them. Yeah, so for this individual, I think they had removed lactose from their diet. So imagine having to cut out lactose from your diet. It means everything that has milk in it, you wouldn't take it. And then if you went to the restaurant to have lunch or dinner, you would be scrutinizing the content of everything, especially the dessert, and even maybe the appetizers, maybe the dessert particularly. Then they also removed, fermentation. Anything fermented, they couldn't take it because they thought that was involved in triggering or worsening their headaches. Pickles also, they eliminated pickles. So imagine taking pickles out of your diet. And then soy as well, and even cheese. So they removed cheese as well, and citrus. So at the end of the day, so they were very meticulous in finding out what these elements are that were associated with triggering and worsening of their headaches, and they made sure they never consumed these things. I think it seemed it was working initially and it helped them for a while, but then the headaches came roaring, and then now they just realized that diet alone was just not working anymore. I know some people also cut out caffeine because they realized that maybe if they consume caffeine, it kind of worsens their headaches. I know some people cut out gluten containing things and thought it could eventually help them. So what is my take about this as someone who treats headaches often? And I consider myself as someone who knows a lot about headaches. I actually even have a special fellowship in headache medicine. So now what is my take on this? And I have also been in a lecture where world renowned experts on headache actually gave their views on this kind of things. Now, they may work for some people, no doubt about it. But when I engaged this patient of mine whom I saw 2 days ago, what I realized was, besides the fact that it could only help them so far and now the headaches are worse in spite of them adhering to these strict dietary, patterns or restrictions, besides the fact that it can only help so far, the other thing I asked them was, how was life in general? Did it not take the joy out of life? Did it not limit your freedom? Because we take these things for granted. There is some joy in it associated with eating. There's no doubt about it. So eating is comforting. So, and then there's the freedom for you of you being able to eat a lot of things, except for those who have certain allergies, and you can't be allergic to everything. So when you start to restrict everything, oh, I can't take this just because of my headache, then your quality of life dips, isn't it? And your freedom is curtailed, and the joy of being able to just pick up anything that catches your fancy at any particular point, you can't do that anymore. And therefore it now looks like the headache has you, not you having the headache. And that's not what we want to have. That's not a situation we want to have. We don't want a situation where your life is controlled by migraine, that you can eat what you want to eat, what you feel like eating, or what you crave eating at any particular point in time. That is not the whole idea. And that's why for some of us, we use some questionnaires in the clinic to assess the impact of your headache on your quality of life, because your quality of life matters. And that's what leads to things like MIDAS score or HEAT6 score that we use in the clinic to see the impact of your headache on your life. Because having migraine is one thing, and the migraine now having you and controlling your life is another. And that's what we want to prevent. We don't want you to be controlled by these headaches. We want you to live a normal life as much as possible. So, where do we strike the balance? So my take is, yes, it is true that if you can commit time to finding out what kind of foods, contribute to your headaches, it's a great thing. It's fantastic. And if you can stay away from it, that's okay. But I think it can only take you so far, and it limits your life. So what's the way forward? I would prefer, for instance, to put somebody on proven, efficacious, preventative therapy that would help prevent their headaches or bring the headaches and headache numbers to the barest minimum than having them restrict their diet and live a restricted life. So both patients, there are two patients now that I've related with or that I've treated who were really into this sort of thing, that they were researching and going into into that, researching into that concept of, something triggering the headaches, and they were heavily invested in diet, and eventually I had to put them on preventative treatment. So my conclusion for these years of interaction with patients when it comes to diet and migraine is, if you're getting frequent migraines, I think you should actually just get to your doctor and get on a preventative treatment so that you can have whatever foods you want to have and enjoy your life and not have migraine dictate what you do. So I would just stand in the middle saying I acknowledge that diet contributes to headache frequency. Acknowledge that is true. However, I don't think one should chase that. And if you want to chase it, good luck to you, that's okay, so long as you think it's not restricting your life too much. But then I would think a wiser thing to do, shall I say wiser? A better thing to do, from my viewpoint, is to accept preventative therapy, because these days there are so many fantastic preventative therapies that can help control the headaches, keep the headache numbers down, and then you can enjoy your life, eat whatever you want to eat. All right? So again, it's usually one tip at a time, and I have put out the tip for today, and that's the relationship between diet and migraine or headaches. So I do hope you enjoyed and learned something. You can leave your comments behind, like, share, and I'll see you next time. If there's anything else I've left behind that you want to know about, you can put your questions in the chat, in the comment section. And if I do remember anything else, of course, I can make a follow-up video on that. And if anything else pops up or any further experiences on this subject in the clinic, I will certainly put it up in my videos. Thank you for watching, and goodbye for now.